infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
One of the things I found very fascinating about your book, and in general, is the topic of handling burials in an Ebola outbreak. And of course, this is a main cause of spread, and including knowing and understanding the differences among the different religions. Can you talk about this and its importance?
You know, we could see early on in the outbreak, Ebola virus disease outbreak in West Africa, that from the epidemiological data, that the spread of the disease was related to funerals, was related to burials. You could see a mini explosion of cases that could be traced back to a funeral. These are unsafe burials. And so, fairly early on in the outbreak, this was identified as a main cause of spread and something that had to be properly managed. Unfortunately, it wasn't properly managed at the beginning, teams would go in to remove bodies, for example, dressed in full PPE, dressed in full personal protective equipment, which I don't know if you've seen that, but it's like a sort of spaceman outfit going into communities, and not being very sympathetic, if you like, either in terms of the faith of the family, or in terms of the respect that was given to people. And so, as the outbreak progressed, it became fairly clear that we didn't have to talk about safe burials, but we had to talk about safe and dignified or respectful burials. And this is where, again, health promotion is very important, because teams were set up in which you would have somebody that was there to impart information to the family and to the community about what was going to happen. There would be a representative, for example, from the faith group of that family, of that community, if it was requested. And the bodies were bagged and taken away in a respectful way. And we developed, I was working at that time with the World Health Organization, working with them to develop a set of guidelines for different faith groups. In that part of West Africa, it was principally Muslim, it was Christian, and it was animist. And we focused on Christian and Muslim groups. And there were ways in which, for both faith groups, in which with the family having no direct contact with the bodies, because obviously the bodies, a dead person is still infected with Ebola. So we had to absolutely stop any physical contact, but it could be done in a respectful way so that people could pray, people could do ablutions, for example. People could do various steps, fulfilled their faith requirements without having any, disrespect, or without having any physical contact. So in the book, I talk very much about how this was done, and I talk about also how we tried to work with the burial teams, partly in terms of training them to be more understanding of different groups, different families' needs, and also in terms of simple things like just properly using personal protective equipment. So I have some tools or some training activities in the book that talks about how we did this in the field. So health promotion is, as I said earlier, is helping people to take control. So it's helping people to gain the knowledge, to gain the necessary skills, and it's helping us to work in partnership in this context, in terms of a safe and dignified burial, in partnership with the family, with the community, which means that, it's better for everyone. It's more respectful to the family and to their religious beliefs, and it's more efficient and effective in terms of the need to collect bodies and to have them removed.